Thank you for joining us today. While we're waiting for folks to join, we'd like to share a little bit about our work.
The National Alliance to End Homelessness is a nonpartisan organization committed to preventing and ending homelessness in the United States.
We build knowledge using research and data to discover what works to end homelessness, and then we develop easily accessible knowledge about these solutions.
Based upon this knowledge, we improve policy through educating opinion leaders and policymakers about what works and try to build strong policy in support of solutions.
We help communities implement those solutions through our Center for Capacity Building, which includes our Center for Learning, providing training, technical assistance, and tools to providers and public agencies.
We bring the field together: policymakers, researchers, practitioners, philanthropy, and advocates to address key issues in the effort to prevent and end homelessness.
Thank you on behalf of the Center for Capacity Building for joining us today. We'll get started in just a moment.
Learn more about our services at endhomelessness.org and look for training at the top of our site. Or email us at thecenter@naeh.org. And thank you again for joining us today. Hi there, welcome. It is so great to have you all here. We are so excited that you all have joined us for this discussion about supportive housing. My name is Rachel Pearsall. I'm the online learning manager with the National Alliance to End Homelessness. And we're just delighted to have you with us today. Please start introducing yourselves in the chat. Let us know who you are, where you are, maybe what the weather's like where you are, maybe what your role is with regard to supportive housing. And we will get started. So a little bit about the National Alliance to End Homelessness. As you saw in the video, we are a national organization that focuses on policy, research, and training in the homeless response field. And we are very proud to partner with CSH for today's webinar. We'll introduce our partner from CSH here in just a second. But before we get there, we wanted to let you know that we want this to be an inclusive and welcoming space for you. So we value diversity in all of our programming. We want you to feel like this is a place where you can be and learn and engage and be free from any kind of discrimination. If you witness anything that makes you uncomfortable, please reach out to a staff member. Just a couple little housekeeping tips. So if you have a question, please use the Q&A box at the bottom of your screen. So obviously we've got the chat going. It's going to scroll really quickly. So please feel free to use the chat to share thoughts and talk with each other. But if you have a question for the panelists, please use the Q&A box, which if you're on a computer will pop up at the bottom of your screen if you hover over the bottom of your screen. And then after the webinar is over, if you want to review it, please check our website for a link to the recording and to a takeaway document. So we'll be posting those probably within the next week, and I'll share here in a second. I'll share the link for where you can get those, and you will be able to see those and share them. And please join us for the next one. So this is the 8th in a series. Yeah, this is the 8th in a series of 9 webinars we're hosting this year on the fundamentals of an effective homeless response system. We've had webinars so far this year about outreach and rapid rehousing. Today, we're talking about supportive housing. We've talked about coordinated entry, all of those vital elements that work together to make a homeless response system effective. And we would love for you to review all of the ones that we've had so far if you couldn't make them, and please sign up for the October one. And again, we'll share the link to do that here in just a second. But first, I'm going to turn it over to my wonderful boss, Mary Frances Kenyon, who is the VP of Training and Technical Assistance at National Alliance to End Homelessness, who's going to talk with us a little bit about why we're talking about homeless response effectiveness from the level of systems.
Thank you for that beautiful introduction, Rachel. And thank you to each of you for joining. If you're in the audience today or watching this recording, but signed up to attend today, we appreciate you. And as Rachel mentioned, we have had this series since January of this year. And we can move right into the next slide, please. So we can talk about why we're doing this. So essentially, when you think about the homeless response system, it's like pieces of a puzzle. And if you don't have one of the pieces to the puzzle can't be complete. We can't end homelessness. We can't prevent homelessness. So the goal of an effective, efficient, and equitable homeless response system relies on all of those pieces. And ideally, we are across the country diverting people from imminent homelessness whenever possible. And in the event that someone does experience homelessness, we get them back into housing as quickly as possible. Next slide, please. And in terms of the end game, many of you already know homelessness is rare, brief, and one time as sort of our tagline. What does that mean, though? It means just what I said. People in a housing crisis have access to immediate help, including somewhere that's safe to go. People are not experiencing homelessness for extended periods of time, so they're not aging into chronicity. People are not unsheltered, sleeping outdoors or in places not meant for human habitation. And again, if someone does become homeless, they are getting rehoused as quickly as possible and not returning once they are housed with those adequate supports and services that many of you as supportive housing practitioners are providing. Next slide, please. So when we think about those system performance measures, I kind of just gave the answer away there. Each of us has system performance measures that is required by the U.S. Department of Housing and Urban Development. And those system performance measures kind of weight how we are doing at reducing the instances of first-time homelessness. So people who have never experienced homelessness in our system, we want to reduce that number of first-time experiences of homelessness. We also want to increase exits to permanent housing. By increasing exits to permanent housing and providing adequate supports and services so that folks can keep that housing, ideally, it will actually decrease returns to homelessness. And of course, lastly, I'm going out of order here, but we don't want people who are homeless outdoors or homeless in shelters to do so for extended periods of time. Again, we don't want them to age into chronicity. Next slide. So what are our system interventions? For a long time, I worked in emergency shelter and I didn't have any idea that there was this huge system out there with different program components to address different needs and gaps within our system. So we kicked off our series really focusing on street outreach, and then we moved into targeted homelessness prevention, followed by diversion or housing problem solving, coordinated entry, emergency shelter, rapid rehousing, transitional housing. There's a joint transitional housing, rapid rehousing component that we just did, and also supportive housing. And we'll close out by talking about how we get the equitable system in place and rounding out next October. Next slide. And there we go. And when we think about our system, the idea behind a system is to increase system flow. So as people are entering homelessness, there are a set of strategies that we have in place. If coordinated in a really effective and strategic way, people will be able to move from homelessness to housing as quickly as possible. So you see a picture of a roundabout. Fun fact, I was on vacation in Aruba and the Uber driver says to me, "Do you know we don't have any street lights here? We don't have any traffic lights." And I was like, I didn't even think about that. In fact, they had all roundabouts because roundabouts, according to Uber driver, said that there's been studies that show roundabouts reduce the frequency of accidents. So again, creating the flow of traffic in an effective and efficient and coordinated way. Next slide. All right, so from the lens of a system. If you think about your role in a system and you think about the broader COC structure that we have, if you make investments without taking into consideration how it impacts the flow of your system, it's going to look a little bit like the picture on the left. However, if you can click, if the interventions are working together, it'll look more like this. Can you press play for me, Rachel? Nope. All good. There we go. All right, so that's enough about our system series. I want us to be able to get into the real meat and potatoes of today's conversations. We have some amazing panelists, but first I'd like to introduce our moderator for today's discussion, Pamela Agava. She is the Associate Director of the Mid-Atlantic region for CSH. CSH is the Corporation for Supportive Housing. It's one of our leading providers of technical assistance for supportive housing providers. She gets to work to increase cross-sector investment in quality supportive housing opportunities throughout the Mid-Atlantic region with a focus on vulnerable populations. So she's an affordable housing advocate. She's got a proven background in providing management and program support through the technical assistance that she offers with her team. She gets to use data to analyze the cause and impacts of racial economic inequality, all while developing client-centered programs and policies to help drive that system change so that we can eliminate disparities and really support and promote economic opportunity for low-income families and communities of color. So with no further ado, I'm going to turn it over to Pamela.
Thank you so much, Mary Frances, and everyone at the Alliance for inviting CSH to be at the table. So excited to be a moderator for today's session. So we want to set some groundwork so that we're all kind of coming at this from the same baseline, right? As you heard Mary Frances talk about the systems level, some of you might have gone, isn't supportive housing the same as, transitional housing or rapid rehousing? What is the difference? All of it is, immediate access housing, right? And there is a difference. There's a major difference in the webinar. I encourage you, as Rachel said, to listen to each webinar and be able to hit on those nuances. And today we're going to focus on supportive housing. So what is supportive housing? Supportive housing combines affordable housing, and in a lot of cases, what we call affordable housing, we're really speaking to deeply affordable housing. So highly subsidized, heavily subsidized housing with services that help people who face complex challenges and are most likely to be systemically marginalized in terms of living with stability, autonomy, and dignity, right? So we know that in our communities, in our society, it can be super challenging to access housing if you have a history that's deemed unvaluable by our society, right? And supportive housing is really about dealing with those complex and chronic issues to advance that individual and that family's ability to live independently. Rachel, next slide, please. So when we talk about supportive housing at CSH, we want to take us away from a subsidized program. I know that there is a HUD-funded supportive housing program, and we have supported that program through TA at CSH in many different ways, but we want to make sure that we are thinking about this as broader than a program that's a HUD-funded program, right? And the HUD-funded program is a great program, but it is very prescriptive, right? And we want you to approach supportive housing as more of a framework, right? Which is thinking about it in terms of a set of evidence-based practices that you continue to implement and iteratively adjust and adapt to ensure that you have the outcomes that you want to see, right? And so what does that look like? That looks like having the inclusion of people with lived experience in the design phase, right? That's a part of being client-centered. It looks like focusing on outcomes versus just the process, right? Even though we have evidence-based practices that we know greatly impact our outcomes, we need to still monitor our outcomes in a way and let that guide how we implement those evidence-based practices. So we're not just maintaining fidelity to maintain fidelity's sake. We're maintaining fidelity, expecting to see certain outcomes. And if we don't see those outcomes, we adjust as necessary to meet the client needs. And then we shift the focus from how to who, right? So we're not here to fix people, we're here to fix problems, right? And so what are the challenges that the population that supportive housing that need supportive housing have, right? What are their goals? What are their needs? What are their wants? And so when we focus on that, we're not as focused on what's the right way to quote unquote fix them. And so that's super important that we think of this as a framework, right? And Rachel, you can transition to the next slide. It may be hard to envision this as a framework, right? Especially if you're like, I have a supportive housing program, right? There are program rules and policies. Well, in a broader sense, let's make sure that we understand that supportive housing is not a treatment model or a method, right? It's not a response as to a diagnosis of any sort, right? It's not transitional. At CSH, we pretty much always say permanent supportive housing. And the idea there is that it's not time bound, that as long as the client needs it, they're able to access it. And it's not licensed community care, right? So any kind of group living, assisted living, right? That's not what we're looking at here. We're looking at independent living. These are individuals and families who would have their own lease, be able to independently live. They have the protections that a lease affords them, right? They're not, their housing is not conditional based on engaging in services, right? And we'll talk a lot about those foundational components, but want to clarify what supportive housing is not, right? And this is where you see the bigger differences between perhaps transitional and rapid rehousing, especially around the time-bound component of it, right? Next slide, please. So some key components of supportive housing. Supportive housing is based on housing first, which is the idea that you don't need to meet certain conditions in order to access housing. So it's not required to participate in services. It's not required to be clean and sober before you're able to access your housing. In fact, it's the exact opposite. We want to give you housing in order to help aid you in your sobriety journey. We want to give you housing and able to help you access services. So it's housing first means non-conditional in terms of being able to access that housing and maintain that housing. The housing is deeply affordable, as I talked about in the previous slide. Many of these individuals and families are facing chronic issues, chronic health challenges, as well as having historical trauma. So there is a lack of income coming in, right? So this does need to be deeply affordable, highly subsidized. It's client-centered. We're focusing again on what the client needs and what the client wants and what are their goals, not thinking about a prescriptive way to become XYZ. We're not making definitions for them. We're listening to the client and adhering to what are their goals and tailoring services and the amenities that we're bringing to them based on that. It's engaging households with multiple barriers through flexible voluntary services, right? So again, there is a group of individuals who are dealing with complex challenges, serious mental illness, substance use disorders. Supportive housing allows them to engage in flexible voluntary services to support them on their journey to living independently and being able to explore their own definition of what thriving in community looks like. It coordinates amongst key partners. And so this is important in that we don't believe any one particular agency or one particular service provider or one particular person is responsible for being accountable to this client. It's multiple partners working together, offering a safety net, if you will, to these individuals and families that make supportive housing successful. And supportive housing connects with community, again, adding to that safety net. The idea here is that those individuals and families in supportive housing are able to fully engage and connect within their communities and live independent and thriving lives. And so these are the key components, and our panelists will be able to talk about that a little bit more. Next slide, please. Want to introduce them. Oh, sorry. So want to encourage you as attendees to listen for specific ways to center client choice, to think about how you're measuring success and quality within your programs, how you are promoting equity, right? And how you are supporting clients in meeting their goals and moving on and moving up through permanent supportive housing. We are going to be welcoming questions, as Rachel said, through the Q&A box, not through the chat. And without further ado, I'd like to take us to our panelists who are all great providers. So first up, we have Tiana Purvis. She is with the Community Housing Network in Columbus, Ohio. Tiana serves as the Chief Operating Officer for the Community Housing Network, and they are a permanent supportive housing provider in Central Ohio. She's been in this role since 2021 and has worked in homelessness and housing for over 15 years. The Community Housing Network is one of the largest providers of PSH in the state with over 1,600 units. CHN partners with both their local continuum of care and their ADAMH board to provide services to residents in need. Using a blended management model of service provision, CHN serves chronically homeless individuals and families living with severe and persistent mental illness and or co-occurring substance use challenges. We also have Lyndia Downey. She's the president and executive director of Pine Street Inn in Boston, Massachusetts. She served as the president and executive director since 2000, but has been on Pine Street staff for over 35 years, working in various roles throughout the organization. Pine Street Inn is the largest provider of permanent supportive housing for men and women moving out of homelessness in New England, with over 960 units of housing and a major housing expansion underway. Last but certainly not least, we have Stephanie Stryans and Jamila Hampton-Duggar from Metropolitan Educational Solutions in Washington, D.C. Stephanie is the Director of Program Operations. She's a skilled psychology professional with over a decade of experience in the field. Her areas of focus include addressing the needs of individuals and families living with mental health conditions and substance use disorders. She consults and trains behavioral staff on topics such as crisis intervention, project management, harm reduction, trauma responsive care, and supervision, as well as professional development. Her extensive client-centered field experience also includes serving as Director of Program Operations for the largest PSH program in Washington, D.C., and providing community-based case management to over 700 chronically homeless individuals and families. Stephanie is a licensed psychology associate in Washington, D.C., and a Human Services Board certified practitioner. Along with Stephanie is Jamila Hampton-Duggar, who is the Director of Case Management Services at Metropolitan Educational Solutions. She has over a decade of experience in the social services field. She's a social engineer, strategist, and 21st century leader who partners with corporate executives, providers, faith-based and community leaders to nationally and internationally addressing the needs of trauma, poverty, and other problematic cycles. She is a native of Washington, D.C., with lived experience of growing up in the foster care system and has a deep and profound passion for serving individuals, families, and children with histories of mental health conditions and substance use disorders. Her areas of focus include working with populations with economic and educational disparities. Jamila believes that peer support nurtures a supportive environment and gives clients a clear path to well-being and wholeness. So we want to say thank you to the panelists for joining us today. We have a couple of questions. Again, as Rachel noted, if you have questions, drop them into the Q&A box and they will feed the questions to us so that we can have the panelists answer for you guys throughout the rest of the session. So without further ado, starting off with what do you see as the mission of supportive housing providers? And I'll hand this off to Lyndia to start us off with just talking about the mission of supportive housing providers as they navigate these programs.
So our mission in Boston and supportive housing in general, I certainly hope, is to end homelessness, especially for people who have been homeless the longest. Our housing is focused on folks that are chronic. We use a housing first model. And I will say that from our perspective, it has contributed to a very low street count. Boston has a street count. We're typically in the top 10 of the lowest street count in the country when we do the PIT. And we've, until this year, been pretty fortunate that we have not added shelter beds, largely because of supportive housing and our ability to really move out long-term stayers and to your earlier slide, Pamela, to really keep the flow going in shelter.
Thank you, Lindia. Anyone else in the panel want to add to that?
I'll add that a core tenet that we tell our case managers is that we work with clients to first obtain housing, of course, then maintain housing, and then address the barriers that led to homelessness. And that's the big piece of it. As providers, we can't always determine what systems level changes look like. We don't get to determine those things. We have to work with our clients one-on-one, do our jobs, provide great services. And sometimes with case managers, providing PSH services on the front lines, that can be tough because there may be some policies that they don't agree with or they think aren't right. And we just have to remain focused on the mission, which is helping our clients get closer and closer to self-sufficiency, helping to, our case managers be trauma informed and trauma responsive and culturally responsive to be able to help our clients on an individual level.
Awesome.
The only thing that I would add is just that, the idea that supportive housing is really there to kind of scaffold supports for the most, the most needed the individuals with the highest needs. So really trying to ensure that they also, in addition to that housing, that really integral part of their journey, that they have all of those resources and they have access to all of those resources, not just so that they can maintain that housing, but so that they can live and thrive. Like, living is far more than just, kind of one component. And so we really want it to be as comprehensive as possible. And that's the point. That's the mission of supportive housing, is to support them living.
Pam, I'd like to add to that. Post-COVID, we've had the opportunity to see a lot of people just branch into entrepreneurship. And so one of our focuses at MES has been really pushing our clients to not monetize their story, but rewrite their story in a way that causes them to branch into different levels of entrepreneurship or to business or art, or to see their potential outside of just receiving a voucher or a subsidy. And so it's been really, really rewarding to push people to experience independence in that way, and to see them really exit case management. And so our mission really is pushing individuals, or teaching, shall I say, teach, train, and empower them to different levels of independence.
Thank you for that. Great responses. Next question, I'm going to direct towards MES, but I would love all of you to answer it in just thinking about the individuals you serve. Have you seen success with putting transitional age youth in permanent supportive housing? The commenter notes that they've seen communities who say that supportive housing hasn't worked with transition age youth because it disincentivizes them to seek self-sufficiency. So I know you guys work with families, but I also welcome Lindia and Tiana to answer that question as well. But we'll start off with MES.
Yeah, so we were excited to pilot a program in 2022 with the Department of Human Services for Youth PSH. It's been amazing to welcome this energetic bunch of individuals into our program, and they hit the ground running. They come to us really eager, a little nervous, a little shy, but we've been able to really help them understand that they are adults. So we've had to kind of redefine that, talk them through what responsibility looks like, because a lot of the services have been provided for them. There's a lot of hand holding, and we want to be there to nurture. But again, our goal is to teach, train, and empower them. And so we want them to find, what did I tell Rachel the other day? We want them to self-actualize, right? We want them to figure out what a goal is and to get excited about figuring it out. And so this group of 21-year-olds, 20-year-olds, 24-year-olds, they're stably housed. We're housing them. When we started in 2022, it took us a little longer to house them during kind of post-pandemic. We are housing clients now within 60 days. We're housing them because they're coming to us ready. They know what neighborhoods they want to live in. They know what programs and jobs, and they're really eager and excited to work the program. And some of the clients that we have from 2022, we're talking about, and we're not trying to discharge, but we're talking about what independence looks like, or another level of case management will look like for them, because they don't need intensive case management anymore. They've been stable for 2 years. They're maintaining their community supports. They have jobs, they're budgeting, they're saving. And so this population has been super excited, along with the support of the mayor, who has put money into that population, incentivized trainings and things like that. So it's been exciting to see them come and with their youth, hit the ground running and really set goals. I'll let Stephanie add if she wants to.
Oh, no, I think she did a great job.
So I'll jump in and I'll add, so at CHN, we have one transitional age youth site-based building for our PSH. And it has been equally a roller coaster ride, definitely an energetic bunch. That's one way to describe them, certainly. But I will say that we have seen greater success in our site-based model with this age group than we have in our scattered site. So we have about 600 units of scattered site and then about another 1,000 units or so in site-based. And when we have seen this particular age group in scattered site, we haven't seen the greatest success. And I think that there's just a lot of different reasons for that, depending on their length of homelessness and depending on their, their origin stories and familial stories. They have varying degrees of success in kind of what you would consider a more scattered site model. But site-based has been amazing for this group. It really has. And I think we are helping them to redefine what a family can be, because this is that age group where they are they are figuring out who they are, and dependent on, again, all of their history and the trauma that they're coming to us with, they may not have had great family relationships or great family units, and don't know how to ask for help, don't know how to maintain an apartment, don't know how to do any of these things on their own. But they are now in this environment where they can share those experiences and those learnings together, and they are they're defining their chosen family. And I think we're watching it happen, and we're watching them be successful. And so our building has been open, I want to say 4.5, almost 5 years. So right pandemic time. And we have some who have graduated on, and we have still many that have stayed and are still figuring it out, but are successful and are figuring it out with that safety net that would not have been available in a rapid rehousing or in a different model.
So we actually don't see a lot of that age group, partially because in Boston we have a group called Bridge Over Troubled Water, and they really work with young adults, and they're fabulous. They have a small shelter, and they run a program like Tiana's talking about. They have transitional housing, and the young people are there for a period of time, and then they're really trying to get them to move on to jobs, to back to school, to something else. We have a very small number of younger folks, believe it or not, that are chronic. You know, our population in our supportive housing tends to be older because they're chronic, and in our coordinated entry, length of homelessness is really criteria 1. So hopefully we're not seeing many of those young people, because we're getting them out before they're becoming chronic, which is a good thing. We have a few, and they do okay. I always worry that they're in our supportive housing with sometimes people that are older than them. Sometimes that is a nice thing for them because it does give them a sense of family and there's some mentors there. But sometimes I think the younger people feel, that they'd like to be hanging more with their peers, and just I think feeling like they have more options.
You all bring up a lot of great points in terms of just the notion of community and how that's built, family and community, and how that's built in supportive housing, right? And just like when any individual, right, we have family that we love to be around all the time, and then family we're like, I would like to see you on the weekends, right? And so, Lindia, you bring up a great point of like, I love visiting my grandparents, right? But if you told me I had to live with my grandparents, I might be like, when I was younger, I might have enjoyed that because then they were letting me do whatever. Now they're kind of like, well, help me, like help me do stuff, right? So the dynamics of how different types of relationships play out, how different age groups want to engage with the community can vary by age group, can vary by location and where you are, right? And Lydia, you bring up another good point about what other resources are available, right? And how to connect to those resources. So that I think is, those are issues that are prevalent regardless of the age group you're serving, but definitely with transition age youth, something that needs to be thought about because so many of those relationship building components have been disrupted by homelessness. And so really thinking intentionally about that is super important, especially in the cases where you end up with chronic individuals. Another question that we've received from the attendees is, talking about the money, right? If it doesn't make sense, it doesn't make sense, pun intended. Many of the clients that they work with have no income or extremely low income, and the locality she's in does not offer a supportive housing program, and there's no subsidy that covers 100% of rent. They're seeing increasing rents within their locality, and so there's a lack of affordable housing options. What are some things that you can do to overcome these challenges? And I might just open this up to the field as a whole. I know a lot of you guys are developers, so that this may take different tracks, but anyone feel free to jump in on this.
So I'll jump in because I think all of us would agree the money's an issue. It's not easy, even when we're both a developer and we work with developers. So sometimes we develop a property and from that development comes some cash flow to support services. Sometimes we are just the service provider. If there's development capacity, we don't do it. And we then work out an agreement with the developer for some cash flow, maybe a portion of the developer's fee. But in Massachusetts, we have two unique things that have made supportive housing work, but we're not there yet, and it has been a very long road. The first is we have a program called CSP, which is Services to People Experiencing Chronic Homelessness, and it's paid for through our Mass Health program. And it's a daily rate. You have to have either a behavioral health or outpatient license. You have to have a master's level staff person supervising the case managers. They don't have to be doing the work. They just have to sign off on the billing. And we're allowed to bill a daily rate for anybody who's chronically homeless and has a documented disability. And it's really, in addition to the revenue from the development of the building, we use that money to really cover a portion of the services cost. It doesn't cover all of it. And the second thing Massachusetts has, and some other states have this, is that we have our own housing vouchers. And we've just gotten the state to agree to add some dollars to the housing vouchers that are used for supportive housing to help close the gap on how we pay for support. And then the third thing we do at Pine Street, but we're all of us who are doing supportive housing in Massachusetts are raising some money to close the gap. We rarely have a project that pencils out 100%. We always have a gap. We try and use other service providers, Pamela, to your earlier point, as much as possible. But a lot of those service providers don't understand housing first. They often have what I would call more of a behavioral health model, and they want people to come to them versus them coming into the building. So while we do that, we absolutely do that, it's more challenging. So we found that trying to patch all these pieces together, to make the numbers work is right now the best we can do.
I would echo that. Diversifying our funding is absolutely critical in any nonprofit, but certainly in housing. Again, we're a developer and a provider of PSH, so tax credits and development fees help to bring in some dollars for our organization, but certainly we are at the mercy of grants and fee for service type things as well. And we also have had to become really astute at telling our story. And I will tell you, I am an introvert. I hate it when someone asks me to go sit on camera and talk about something, but telling our story and being the voice for our residents, allowing our residents to have opportunities to tell their stories themselves and to really to bring that forward has helped. It's helped us raise dollars and you know, reach new donors and do new philanthropic dollars, which fills the gaps and helps us allow to continue to be able to provide supportive services. But none of that really addresses, I think, the other piece of that question, which is just the rising housing costs, right? I think being a developer helps us kind of stunt that a little bit, because we're able to be a tax, you know, do a tax credit project and keep the rents affordable in our building. But the pace is hard to keep up with, certainly.
Pam, I'll add to that. It's two-part for us. So for just with ISPs and treatment planning, we really push our case managers to focus on the income piece. You cannot be zero income in Washington, D.C. You just cannot. I work sometimes more than one job, and rent is difficult, right? And so for our clients, we're working with them to ensure that people that can apply for Social Security or disability can. Those that would like to explore skills, because there are trainings that they can be incentivized to complete, to go back to school. So we have those hard conversations about increasing income for our families. We're really pushing them to, and it's a hard conversation to our clients, because a lot of them, poverty is generational. And so it's tough when they're trying to figure out how to really come off of TANF or food stamps and things like that. But we really try to support them in going back to school and getting the skills to be able to take care of their families. The other part of that is we were lucky enough to transition pre-COVID to Medicaid, right? And so our PSH program is funded by Medicaid now. And it's allowed the Department of Human Service to be able to help us afford a lot of those amenity fees and building fees and parking and a lot of the things that allow our clients to experience nicer communities and luxury buildings and things like that. And so that has kind of offset some of the burden of cost for our organization. Unfortunately, we are not a nonprofit organization. So of course, we depend majorly on being able to be able to support our clients and to provide that extra support to them.
Awesome, thank you for that. So this is a two-parter question. We're receiving a couple of questions of talking about, you know, high acuity, high need clients, and how do you ensure that you have the right type of case management? One of the questions is pointing out that, you know, it seems like there's varying levels of case management. So how do you support bringing in the right level of case management if you need intensive case management versus, you know, lower level for these high acuity need clients? How do you support them? This question, one of the questions notes specifically in rural areas or rural localities. And then how do you balance that with being, you know, in terms of being housing first minded, but also ensuring that these individuals are housing ready? So a huge two-part. I'm letting the question kind of sink in to make sure I communicate it correctly. And I'll pop it over to Tiana to go first for us.
I want to make sure I understand the first part of your question, which is how do we manage individuals with high acuity or high need, right? Mm-hmm. So there's a couple of different strategies, but the foundation is you got to have the right staff ratios. And that's not a simple solution, because that requires funding, right? But you got to have the right staff ratios. I think a lot of community mental health organizations, or just mental health organizations in general, are doing are out there doing community work at astronomical ratios, 500, 1,000 people to one. And so you don't have good eyes on folks. I think the benefit of supportive housing is that it is, even if it's not site-based, even if it's scattered site, the person is in one place and you know where they are and you can kind of come to them, you bring the services to them. That is kind of the idea of how those scaffolding supports are able to be of use to them. But you got to have the right ratios. Here at CHN, we were blessed to be able to move our ratio from 1 to 208 to 1 to 50 approximately through a great donation a few years ago. And that's approximately the difference between 3 staff and 13 staff, right? So, I mean, that was huge. It grew our program and it really allowed us to have dedicated caseloads, dedicated case managers for specific units and neighborhoods. And it changes the dynamic of the service that you're providing. So whether or not in your 50, you have some folks who are low acuity, some who are medium, some who are high, you still have a greater opportunity to have FaceTime, greater opportunity to be familiar with the resources, to link them and refer them to other partners. And so you are able to, again, fill the gap and scaffold for individuals at all levels. And then, again, if you have a good staff ratio, you're able to be flexible and provide deeper services when needed to those who have higher needs. So I think that's my answer.
Yeah.
I'll add to that, Pam, and I want to talk about your comment about case manager requirements and in terms of staffing and having the case managers be ready to take on high acuity clients, especially in the past few months. We're seeing a huge influx of clients that are being assigned to us either through client choice or through other programs that really do have high needs in mental health and substance use disorder and long history or episodes of homelessness. And that's a lot for a case manager to take on. And, of course, we have to follow the Department of Human Services and their regulations for what sort of education or experience that case managers need. But it is also our responsibility as a director of case management services and program operations to make sure that our staff is prepared. Something I say in day one of onboarding training is you can have been doing this for 20 years or 20 days. This training is important. You have to understand what's required here and what's required with our client base. And so we do a very extensive onboarding training. We prepare our case managers with de-escalation and with safety protocols and a basic understanding of mental health and what to look for. But I do stress that we're not mental health case managers, and we need to consistently expand our resources and our toolkits so that we're not that one person for your client. Some case managers think like, I can do this. I'm the best person. I know my client the best. And that's an amazing, train of thought, right? We want our case managers to be passionate. We want them to have that desire to like, I'm the best one. I know my client. I can do it the best. But what you fail to realize, and what I try to tell our case managers is, if you are limiting your client to just you, you're limiting their pool. You need to expand your resources so that way they expand theirs. If you increase your circle, you're also in turn increasing their circle. And that goes to self-care and burnout and, from a business standpoint, retention. But there's a lot that goes into case manager staffing. And I do a lot of interviews, and I look for passion and I look for patience, because I can teach someone how to write a case note. I can teach someone how to write a treatment plan, but I can't teach someone how to build rapport and go into a home and be authentic. I can't teach authenticity. And so that's what I really look for with case managers in the hiring process.
Thank you for that.
I'm gonna double down. It's not even just your case managers, it's your partners, it's all of your community linkages and resources. I'm not gonna utilize an organization that doesn't think and speak about who we serve the same way that my folks think and speak about how we serve, right? If it's not person-centered, it's not client-centered, I don't want it, because I'm not gonna subject my residents and my tenants to that, right? So absolutely, the empathy has got to be foundational. And again, back to the question, when you're thinking about folks with high acuity or people with the highest level of needs, they need this full spectrum of services, right? And so we have to make sure that every single bit and piece that they choose to utilize, because they may not choose to utilize all of them, is client-centered, strength-based, solid, evidence-based practice, and that it is, it's going to be of support to them when they choose to use it. And that's really the part of the answer, is just making sure that it matches your model and matches who you need, who needs the services.
I do think it's a huge challenge. Oh, sorry, Stephanie. It's a huge challenge, I think, to find people to really what everybody said. People have to be tenacious case managers. We hire people who don't have experience with homelessness, but we have to feel 100% confident the way Tiana does and Jamila and Stephanie do, that they're going to get the mission. They're going to understand housing first. They're going to understand that this is not about compliance. It's about meeting people where they are, working with them from there. You can teach people all the other stuff, but if they don't have some basic acceptance and understanding, it's pretty hard for someone to walk into a high acuity environment. It's not, I think, what many typical case managers do, honestly. So it's not every case manager is a fit for this. The one other thing we've done that has been really helpful for us is we've privately funded a small behavioral health team. We have a private grant, and they support our entire portfolio. Sometimes they're directly working with tenants. Somebody's in crisis, they might go in and work with them. Most of the time, they're coaching the case management staff and saying, look, why don't you try this? Or I know you did this, but maybe there's something else that we could try. And, if the case managers try and we're not successful helping someone, we'll bring the clinical team in. But, you have to be able to pivot from everything from, how are you going to help people get primary care? And so, you need to understand the systems out there that our folks rely on, everything to, sometimes we have to section people if things are really not going well. And you have to understand that world and how to make sure that tenant gets treated well through that process and can come back to housing.
I was just going to add that the peer-to-peer approach, you really do have to. And we were lucky enough.
Yeah, I agree.
We piloted a peer program, and we brought on a bunch of peers, and we matched them to our case managers. They had the opportunity to go out in the community for about almost 2 months to meet with our staff. They got a chance to do every aspect of case management. And we were fortunate enough to find a couple that were great enough to hire. And so we've onboarded a few of those peers. And then of course the HCA allows us to hire peers, that lived experience replaces the education piece. And so who better to support a person with that high need than a person who has experienced that rock bottomness, that same level of, maybe not the same level of mental health, but they can identify with the experience. And so it absolutely does it increases retention, because a lot of our some of our case managers we've hired, they have that book sense. They've gone to school, they have their degrees, and they hit the ground fresh out of school. And they are not prepared to deal with the level of idealism that college gives you for this population. And so hiring a peer is perfect, because they get it and they can say, I not only understand, they can then reinforce, those positive goals, and they can address the landlord issues. They can connect them to the supports that they're aware of. They can expand their search, and so they get it. And a lot of times our clients just want to be heard and seen. They think we don't understand, and to have a peer is dynamic.
Thank you all for that. And I am going to piggyback off of, I can't remember who commented on it, but it's been popping up in the questions a lot. Engaging with partners as they are working with clients, whether they're high acuity or not. And how do you work to either cross-train, particularly your property management, your landlords, push back against bad attitudes, negative attitudes, especially when housing is limited, right? And so you feel like, I don't have a lot of landlords that want to work with me. I don't want to piss off this landlord. because that's even less units that will be available to me. But at the same time, I don't like how they're engaging with my clients, that they're not understanding the goals of this program. They're not being flexible in terms of, including case management as a part of the process of working with that tenant. What are your thoughts about how to kind of navigate that? And Tiana, I think it was you who was talking about, the partnership engagement. So you can go ahead and kick that off.
So I don't know if I'm going to answer your question right, because here at CHN, we are both the property manager and the supportive service provider. So we are having all of this going on in-house, right? Where we have our traditional kind of property management department, which is, concerned about the asset and concerned about rent collection and, housekeeping and all of those things. And then we have our service team who are going in and trying to make sure that people are stable and linked to resources and that they feel connected to their communities and feel safe. So we operate what we call blended management as our kind of evidence-based practice and approach. And it is so blended that you can't even put a notice on someone's door without it being something that is collaborative and developed by both property management and services. So we require that our teams work together. I will not say that it's perfect. I will not say that it happens all the time. And I think that especially when we end up hiring staff who have come from like a market rate rent or from, more traditional rent, it is a shift to kind of come into a supportive housing environment and really look at and utilize and lean on services in that way. They don't get it, they don't understand it. And so it is part of our training. We have blended management roundtables regularly, where we are really requiring both sides of those staffing pattern to kind of come together and discuss, how do we work through this thing? What are our tools that we use at our disposal? Some of the things that I want to see is I want to see a tenant plan every time there's a behavioral issue, because that means that the tenant is involved in creating this plan. They know what's expected of them, but also the property manager has a function and the case manager has a function. We all have a part in making sure that this person can be successful and that this plan, is actualized. We also just try to, utilize different tools at our disposal. We're not trying to have people return to exit into homelessness. So if there's a way to do a mutual rescission or an agreed judgment entry at court, if it really kind of got all the way there, then being in the property management lane, we're able to kind of make some of those flexibilities and those concessions, whereas, a private landlord may not be willing to. So it really is all about what's going to be the best thing for this tenant at the end of the day. Again, we want to maintain our asset because we want it to be available for the next person who may need it. But we want to see that person is successful. So where we can reduce the red tape and do it more collaboratively, we do.
And for us, we we have a diverse pool of landlords. We have them across the spectrum. Of course, because our clients are, we think of them as far as their housing abilities, sometimes across the spectrum. And so we have private landlords that we work with. And of course, I think it's all about education, making sure that the landlords understand our clients and the population. We've had developers come into our all staff meetings and to talk about what their qualifications are and to work with our staff. We have our leadership team whose responsibility is to go out and to grow those resources and to bring those back to our teams. And so there are some landlords who can handle some of those higher acuity clients. They understand it. There are a lot of landlords that we come in contact with, and it's all about the hard work, right? But there are clients who tear their units up. And so we've had to kind of figure out how to create a pool that kind of fits everyone across their permanency, I'll say, and so we're just trying to figure out how to keep clients housed, and it has to be a good fit. It needs to be a good fit for the client. It needs to be a good fit for the landlord. And so we try to work through that and making sure that clients understand their rights as tenants. The other part of that is that we were lucky enough to get, and I'm not sure who, Pam, you may know, in DC, they created the Landlord Partnership Fund, where landlords now can kind of get the support because they look for case managers to advocate against their clients. And I'm like, I'm never going to admit anything that the client has done. Who does that, right? No, I will never. And so, but they need a safe space too, so that they can, get the support. And so in this fund, they put, money towards arrears,
Security
arrears,
deposit.
security deposit. They put money towards
Repairs.
repairs after the security deposit has been exhausted. And so those are the things that within the first 30 days, we have every landlord sign up for these just in case funds, because we want our clients, well, of course, at MES, we want to house our clients, and we want to, share the message that they're the best fit for these landlords. And so we get them to sign up for these funds just in case the relationship goes south, across the term of the lease. And so that has been a great thing for us to find landlords that understand our program and can support our clients. And then the partnership fund has been great.
Yeah, I don't know that I have a lot to add. We do our own property management as well. For years, our board has been saying to me, why don't we bring in a property management company? First of all, a lot of our properties are small, and so nobody's really interested because they're smaller properties and they're scattered. It's not very efficient. Having said that, lots of times our property management team know as much about the tenants as the case manager. They're in there all the time. They're changing light bulbs, they're painting. The tenants are calling and saying, my sink's dripping. And so they're in there talking to them, and oftentimes they are kind of an early warning sign sometimes that something's up. But it's very collaborative. The property management team is at the case management meetings where we're talking about, rent issues or hoarding issues or whatever might come up. And we also have a small fund for landlords for our scattered site program where we basically guarantee a small pot of money. So if the unit gets damaged, we can come in above and beyond, first and last and help the landlord with repairs.
Super important. And I see Rachel coming on. So I think, are we at
Nope,
time?
we're good. We've got until 4:30. So
Perfect.
if y'all want to keep going until about 4:20 or 4:25, that would be great. Lots of
Awesome.
questions still coming in.
So some questions we've been getting around housing first, right? How all of you implement it with fidelity, and again, the housing readiness, a term that CSH isn't particularly fond of, but navigating that, right? How do we assess and determine whether, to Jamila's point, where housing, what particular units make sense for what particular tenants, right? It is sort of a matchmaking game. There, as you think about certain landlords, and this goes to that partnership aspect, right? You know that you can get away with, maybe the example I'll use is, my parents versus my grandparents. There, I know how much I can get away with. I can take the full mile with my grandparents. I can only take not even a full, I can't take the 2 inches with my mom at all, like barely half an inch. My dad, I might be able to get like 6 inches out of it, right? Like, we know how much we can stretch the relationship, and knowing your partners in that way is super important for navigating the ability to form those strong relationships, and being transparent and honest and communicating is how you build that. But when it comes to the tenants, right, your goal is supposed to be to house them. And right. And when we're talking about being client-centered and focusing on client choice, they sometimes want to make choices and you're like, this is not going to be a fit. So how do you navigate having those kinds of conversations, really thinking about maintaining being client-centered, maintaining housing first, when from your perspective, there seems to be obvious tensions or things that won't align perfectly? And Lindia, I think you can hop in first with this one.
So all of our housing is housing first, and we for many years ran what I would consider to be housing ready housing. The problem was we weren't really having any impact on homelessness because the only people we were housing were people that were homeless, for the shorter term, and we couldn't get our longer term chronic folks out. So in Boston, our city, owns our continuum, and our coordinated access really, you get priority 1 for supportive housing if you're chronically homeless and have a documented disability, along the line with the HUD regs. So everybody we house is a housing first tenant. So we don't really talk to anybody about housing readiness. We just target the list, and then we start to look at where's there a vacancy, where might there be the right fit on the support staff end. Sometimes we have a unit, and especially when we're working with folks on the street, sometimes they'll say, no, I don't want to go there. I don't want to be in that neighborhood, or, it's too far away from where I'm sleeping, on Washington Street. So it's a negotiation with people. But we we really had to make a shift. We did it many years ago. I think there's still people who say, why are we doing this? But really, all of our tenants, there's no sobriety requirement, there's no medication requirement. We don't even have an income requirement. We've worked with our local housing authority, uh, from where many of our vouchers come, and we've gotten them to mitigate any queries up front. So if there's a criminal issue, or anything like that, it used to be we had to go to the housing authority. They would deny us, and then we'd appeal, and we won most of them on appeal. And we went back to them and said, "Look, you're going to let us do this on appeal. We're just going to try and mitigate it up front." So they've let us do that. They're a lot more willing to work with us on criminal record and other things like that if they know there's support on site. So they're a little less enthusiastic, frankly, about scattered site where we don't have as much support versus on site. But you have to be able to work with people that are actively using, and people that are psychotic, and people that are in crisis. We have lots of tenants that are really stable and quiet, and don't need a whole lot from us. But last year, our retention rate in housing was 96%. And that means from one year to another, 96% of our tenants we house stayed housed. So we work really hard at making sure you don't slip back into homelessness. I, re- you know, just like everybody, once in a while we do evict people, but honestly, we rarely evict for lack of payment. We can find money somewhere in the system, to help you with your rent. What people end up losing their housing over is if they're actively using, it becomes a problem for the rest of the tenants. They're maybe not sitting in their room using, but they're out, creating other problems for the tenants. And that's where we kind of get into the legal quiet enjoyment, and other tenants are saying, can you do something about this tenant? But most of the time when people do end up losing their housing, it comes back to the behavioral stuff that we might not have been able to help people with. In all honesty, we might have tried to bring in our Department of Mental Health. They weren't successful. But I'm really pleased with our retention rate given who we're housing, because we don't control the list. The city just sends us names of, this is who was homeless the longest, and we work our way up the list. So that's how we fill our supportive housing.
I would just add, we fully and wholeheartedly believe in housing first. There is just no way that someone can focus on education, employment, increasing their income when they don't know where they're going to lay their head that night, where they don't know where their next meal is coming from. So I want to put that out there, but that doesn't mean that it's easy. It's definitely difficult, most of the time. And that's where, when I was speaking about passion and empathy and authenticity, that's where that really comes in, because you are coming in and working with someone, and they may have been working with an outreach caseworker for years throughout homelessness, right? And you're walking in and saying, hey, I've got this golden ticket, I have this voucher, you have to meet with me, you have to tell me your whole story after I've met with you for 5 minutes, and I'm gonna get you housed, and it's housing first, and you're coming with this big amazing thing, and they want nothing to do with you. You have to be authentic and build that. And what I discuss with clients when I'm doing those initial applications and trying to get them into housing is being honest, right? I know some of these things are difficult. I hear you. We can go as slow as you want. We can take breaks. We can do whatever is needed. If someone that you trust, like an outreach worker, needs to be present during that initial application, absolutely, let's do that. Whatever makes you feel more comfortable, because getting through that application, talking about your history of homelessness, talking about substance use disorder, talking about any criminal history or evictions, that's going to be important steps that are beyond my control, right? When it comes to getting your voucher. And so we want to house our clients as quickly as possible, but we also want to make sure that we're giving that individualized service so they feel comfortable about it. And we're not just throwing someone into an environment that they're not going to be successful in.
I love everything that has been said so far. And of course, at CHN, we are also, our housing first, and we're trying to remove as many barriers as possible so that folks can come into our housing. And like many PSH programs, all of our services are voluntary. So we really want to make sure that they are as attractive as possible, and that we are really building that relationship from the beginning during the application process. So we try to make it so that the person that they're meeting with at the lease up and at the application process is the same person that will end up being their case manager, and really follow them kind of through so that they're able to build that trust. One of the things that I love, Lindia said, is just the relationship with the housing authority, which is where we get most of our vouchers from as well. We used to be in the same position where they would deny us and then we would appeal, and then they would allow it to go through. And so now they also have kind of allowed us to really make our tenant selection plans that much more flexible. So we have maybe more flexible look back periods for certain offenses than the housing authority may, or than a traditional landlord would. And I think it goes back to what you were saying, when they have confidence that there's going to be supportive services on site to really scaffold that individual, then they're willing to kind of take that risk and allow that voucher to be dispersed. The other thing is, things that get in folks' way, like not having an ID. If we can get a copy of it from somewhere else, even if it's expired, I'm gonna take it. That's okay. I would rather put you with a case manager later who can take the $20 and help you go get a new one than you not be able to get into this housing right now. Let us find a way to kind of, remove these barriers and remove this red tape. So yeah, flexible tenant selection plans really help us have a larger pool of folks that can kind of come into our housing quickly.
Thank you all for that. And I think it's important for our attendees to note that, for some of these issues, there does need to be advocacy work, right? You need to persuade your partners to your side, right? It isn't just like, don't you see, this is the most obvious thing, right? They're pointing out that it is work, right? And so you need to put in that work, right? And talking to your partners and really engaging partners on the long-term benefits, right? Either we're going to have these frequent users of the system who are continually unsheltered on the street, accessing emergency rooms, or at being in our shelters, which are over capacity, and we haven't figured out how to meet their needs there. Or we can, implement this policy that definitely will help move people much quicker through our referral pipelines and help them access housing. And overall, what we've seen is that, similar to what Lindia is saying, there's this belief that like every single person coming from homelessness is unready to be housed, right? That they're going to tear up a unit, that they're going to, you have to push back against that narrative, right? But once property management actually see these individuals and realize, oh, this person's just regular, they just happen to have been chronically homeless before moving in here, right? You have to push back against some of the negative stereotypes. And then for the clients that we know do have more vulnerabilities in terms of their diagnoses, being honest and transparent about that so that we can have conversations about where it makes sense, right? So, something that frequently comes up when we talk with providers of transition age youth is, why would we put them in buildings where there is a no loitering rules, right? Nobody can hang out in the hallways, nobody can hang out in the community spaces after a certain period of time. Those buildings might be good for other clients, but for youth who are like, I have insomnia, or even if you're talking about adults who have some of their chronic mental illnesses, some of their medications result in insomnia, and they like to walk the building, right? Being in a building where that has rules or quiet time hours where you can't be in common spaces after a certain time of day is not going to be a fit, right? And so then you're going to see increased lease violations, but really it was never a match to begin with, right? So when we talk about housing first, a lot of it is in the details of just not saying, and that's a part of being client-centered. It's not saying you should take the first housing unit that's available to you, whether it fits your diagnosis and the side effects or the wants you have or not, right? Housing's limited, so and you were homeless before, so this is better than nothing, right? That mentality doesn't fit with housing first. Housing first also challenges the notion that an individual has to be worthy of housing, right? Which is essentially what we mean when we say housing ready. We say they'll be able to, not mess it up. If I took out the virtual screen behind me right now, the mess it up that is hiding behind me in my home office is not to be talked about, right? But for some reason, this person who's been chronically homeless, we feel like they should be able to maintain a perfectly clean unit 100% of the time, never have issues, and we put unrealistic expectations there, right? And so we have to challenge our partners around that, especially when it comes to housing first, because again, a lot of that is based in the stigma and the biases and the prejudice we have, not necessarily the actual the actual experiences that anybody has had. And I think the noted having funds available for those extreme outlier cases where there is property damage beyond what can be covered by a security deposit, those are great things to advocate for, to have in place within the system that can help your partners, your landlord partners, build confidence in the program. But I think, just overall, it's about advocacy and changing the narrative around the types of individuals that are coming. Yes, there are high acuity individuals, but you as a property manager, you as a landlord won't be supporting those individuals on your own.
Pamela, you made me think of a story about when we first started doing Housing First, and we housed a guy named Phil. He had been a mailman in Boston and had some really severe mental illness. And he was a cash kind of guy. And so we said to him, Phil, you got to pay your rent every month. He was like, what do you mean? No checkbook, no bank account. He'd get his Social Security check and he'd literally go up to the bank and cash it, but he never had a bank account. And he smoked cigars and he liked to go out to breakfast. Those were his things he wanted to spend money on. And I remember we had to work out a deal where Phil had to come in every day to the case manager's office with $2 to pay his rent. His rent was like $60 a month. Because for Phil, he didn't mind handing over $2 in cash. It worked for him. He could see it. He knew it wasn't a lot of money. It wasn't a lot of money all at once. He could still go and get his cigars and have his breakfast down the street. But it gave the case managers eyes on almost every day that Phil came in. You kind of got a chance to look at him. He was older by the time he came in. He had some health issues. You can kind of keep an eye on him. But, it took us a couple months to figure out what would really work for Phil, because Phil was having none of this, get a bank account, write a check, wanted nothing to do with it. So you got to be creative sometimes. And it worked, and I think a big piece of supportive housing is trying to be as creative as you can.
Jumping out of the status quo for sure.
Can I just add, this idea of housing first is not just like at the beginning. It's not just like housing first at one time. It really is like all the way through this relationship and ongoing as long as they remain in housing. And it even goes all the way to, a potential termination. So in the event that you have someone whose behavior has got them to the point where we are going to be, seeking eviction, or us as the landlord, we're going to be seeking judgment. It is us, advocating for an agreed judgment entry or a mutual rescission. We're going to try to help them turn their project-based voucher into a housing choice voucher and help them find a unit out in the community where they can maybe be more successful, right? We don't want them to exit back into homelessness. And that is the purpose of housing first, right? It's to get them out of that housing, that homeless situation, and remain out of that homeless situation through the life cycle of our services, even if that means they're no longer with us. So I just want to add that, because I know that sometimes it just feels like, oh, well, we did everything we tried, but our responsibility is still, to get them to a stable situation, wherever that is.
Thank you for that. And that transitions well into one of the next questions we received, which is, how do you structure your PSH programs to, recognize the permanent part, right? That these clients can be here as long as they need it, but also still encourage the self-sufficiency and the ability to move on and upwards beyond the program, right? How do you balance that in terms of your case management and how you structure your programs, and what are different strategies you use?
I can start. Every client is different and every client is at a different stage. And so if your case managers are working with clients in the same capacity and trying to copy and paste and do the same thing with each one, that's not going to work. And even with a singular client, even doing the same types of services throughout their time in PSH isn't going to work. I'll have case managers that come in and want clients that have been housed and in our program for 10 plus years because they think those are the easy ones. Those are the hard clients because you really have to give them a reason to answer the door, to open the door, to engage in services. When a client is newly assigned and they need a voucher and they need housing and they need all of course they're going to meet with you. And so not even just case by case or client by client, but throughout a client's time in the program, you have to be creative. You have to look at what is going to work for that individual client. I love that story about Phil and the $2. That's the epitome of what we have to do. You have to do something different for every single client. You have to do what works. And yeah, we have stories like that too, of clients that had the money, but couldn't get it together to get stamps or put it in the mailbox. And so we would make sure that we met with them on the 1st of every month or the 2nd of every month, and we would do that process with them, but also transitioning them to not need that level of care every single month. So, okay, I'm going to do this with you for 3 months. And then on the 4th month, why don't you try to fill out the envelope yourself and I'll come over and see what that looks like. And then you slowly transition towards self-sufficiency. But you have to be patient with clients. You have to be understanding and you have to be open to trauma that they've experienced, and you can't judge someone. You can't say, I don't understand why this person doesn't just call the landlord. It's just a simple repair. I don't get it. Maybe they're this, that, or the other. And you can't do that. You have to really be open to everyone's situation and not have this, oh, I see it in the chat, not have cookie cutter approach. Thank you to whoever gave me that language.
I love all of that. I was like over here, amening you the whole time. Yeah, everything has to be individualized. Like this is the nature of our work. We are dealing with real people with real experiences and real trauma, and it is going to be different for every single one of them. And I love that you said it's not going to be the same as someone who is just housed as someone who's been in your housing for 10 years. What you used with that person when they first got housed 10 years ago is not what's going to continue to help them engage today, right? Because we are all growing and all on this plane of life. But yeah, individualizing the services and being creative, utilizing your partners, your colleagues, your peers, their peers, and really, finding out what is driving and motivating them and what their true needs are. Also being willing to redefine what success is, right? It's not just whatever our assessment in front of us says. Well, once you score this, it says that you're ready to leave and to move up and on out of housing. But what does success really look like for that person, right? What is their level of connectedness in the community? Is it that, yes, they have income now and yes, these things are all checked in boxes, but they still don't even know their neighbors, or they haven't had a relationship with their grandma in 4 years. Maybe that's the next goal, right? To really help them be successful and to move on and out of PSH if that's the right next fit, but being willing to have it be different than neighbor A and neighbor B.
Yeah, Pamela, I'd add one more thing. We use a tool, frankly, that we made up, kind of a phase of care tool for our case managers, and where we look at, are people in crisis? Are they stable? Are they thriving? And if you're moving into thriving and you're paying your rent and you're, really taking care of all your ADLs and you're cooking yourself and you're really engaged with the other tenants in the community, we're going to start talking to you about, hey, is there something else you want? Is supportive housing still for you, or are there some other options? People move in and out of that, though, to Tiana's point, all the time. We had someone a couple of years ago, a woman who lived in one of our Brookline houses. She had been with us 7 years, was doing really well. We were talking to her about moving out, and she picked up and started using again. And she kind of went back to in crisis. She ended up hospitalized and was actually got pretty sick, had some health issues. It was only a couple of years after that we started saying to her, hey, things have been really stable again. How about talking about moving on? But we try and at least have some criteria for each one of those categories as we're working with people to see how things are going, knowing that people don't stay in those categories. Life changes for people.
Certainly. Thank you all for that. Got a couple of minutes left. We're going to transition into just hearing more from the audience. What are some of the biggest takeaways that you've had from today's session? I know we didn't get to all of the questions. Rachel was feeding them to me, but we were getting such great responses from the audience that I wanted to, give them space to answer. But what are some big takeaways that we have from today's session? We're using this cool board. You can drop it into the chat.
And that was a question for the attendees, by the way. So we're interested in knowing what's something that you are going to take back to your day-to-day work from this. Bridging resources. Yes, bridging resources is super important. We had a lot of our panelists talk about bringing in philanthropic dollars. I know we did see some questions around Medicaid, and Medicaid is more than the time that we probably had allowed. But even with Medicaid, you have to braid multiple financial sources, right? It's Medicaid in and of itself will not take care of all of your costs. It does significantly often increase revenue, but it is not an end all be all around dealing with costs, right? So you're always bringing in multiple sources to deal with that. Creating a support system for the client. Yes, I always kind of say it as a safety net because it gives the at least for me, I'm a visual person. And so even when people are suggesting things, right, you want the visual of multiple strings coming together and, forming connections, making different knots and connecting at the right places to be a full safety net, right? No one provider or property manager or one person should be totally responsible for being everything that this individual needs. That's a surefire way to get to burnout and having really bad outcomes, because we are not all I'm old, and I was told I was old when I said this at some other seminar. We're not all Captain Planet. Apparently, there are many more recent and relevant superheroes that we could use, but insert the one that makes the most sense for you in terms of meeting needs, right? You're not the superhero in this person's life. You're one amongst many amenities and services and resources that they're able to tap into. And if you think about your own life, that's really how it works. When hiring, you want the person to be real and authentic, and peer support is a great idea. Super true. We had great conversations around what to be looking for in your case managers, also your partners, but also really thinking about the strategic use of peers as a way to really meet client needs, but also help fill in gaps in terms of staffing and case management caseloads. So definitely something to continue to advocate around and think about how to do that well. Landlord engagement. Yeah, that's a big part of this, right? Really navigating the stereotypes and the pressures that we receive from other partners in terms of their own biases and their own fears, and how to address them in a way that allows you to build rapport so that they are going to treat your clients the way you would treat your clients. Cookie cutter is not a good idea. That's definitely the takeaway. Cookie cutter is not an ideal for landlord engagement, for client engagement, for any of it, right? It really is about being person-centered, client-centered, and that looks like really thinking about the person, thinking about the partners that you're going to use to engage to support that client. All of this, requires a lot of strategic thinking, right? It's not just accidental and you kind of it just all falls into place. You really have to really think about who will work best with who when you're thinking about case management assignments based on skill set, based on history, right? When you're thinking about where a tenant's going to live and you talk about their unit choice, you have to have really serious conversations, be transparent about what is available,
housing affordability is a super big issue. And so, when a client comes to you and asks to live in a place where it's like your voucher is not going to cover that, or that place is not going to have any availability for you for another 6 months, and we don't want you waiting for 6 months, right? Being transparent and having those hard conversations is super important. It's going to be challenging in the present sense, but it builds trust long term because they know you weren't hiding information from them or lying to them, right? So really having honest conversations so that these individuals can be practicing their autonomy, right? So being transparent about, hey, your voucher doesn't cover that, right? So these are the options that are covered by your voucher. What do you want to choose amongst those options, right? And being honest and having those conversations rather than feeling like you need to make the choices for them. It's work. It is work, right? At CSH, we like to say, the Mid-Atlantic team, we like to say that PSH is detailed, right? Not that it's confusing or that it's hard, right? It's detailed. And so thinking through those details takes time. It takes, making sure you have the right people at the table. So we're so happy that this panel included someone with lived experience. That's super important in terms of the building strategies that you're doing. That should be a major takeaway, right? Having the right people at the table to have these conversations is super important, so that you're getting the perspectives that you need to be making informed choices about how your program is set up and how you're partnering with people, right? And that is very detailed work, right? So it's time consuming, right? It takes thought, it takes effort. And so we need to be conscious that we need to put in that work for sure. Chat is moving quicker than I can see. Rachel, other points?
There were so many good points, but we're out of time. And I want to be sure that I'm being respectful of people's time today. So I've got one more slide to share, and I'm also going to make sure that I invite everybody to sign up for the last. Okay, I'm going to stop the share. I'm going to. All right. Here's the last thing that we're going to share today. This is everybody's contact information. And I also want to make sure that everybody knows how to find the recording, find the takeaway documents, and also sign up for the last of these that we're having this year. Not the last webinar we're having this year, but the last of the Stronger Together system series we're having this year. I just put that in the chat. Take a look. You'll be able to find the recording and the slides sometime next week. We've also got a one-pager that we'll post there with takeaways from today's presentation. And I cannot thank all of our panelists enough. Pamela, Lindia, Jamelia, Stephanie, and Tiana. Thank you. You have been fantastic. Thank you also to Mary Frances and Alec, my colleagues at the Alliance, and as well as Dave and Josh for helping to answer questions in the Q&A. I learned a ton. I hope everyone else did too. And thank you so much for attending.